People with long COVID complications suffer from a variety of problems. For some, that includes neurological issues, and it is an area that's being studied in order to try to figure out how to help these patients. Dr. Lakshmi Warrior is the chair of neurology with the Cook County Health Systems and joins us now to discuss this. Good morning. Good to see you.
Good morning. Good to be here.
So tell me, what are some of the more common neurological issues that you guys are seeing?
Sure. One of the most common things is loss of smell. That's often a early sign of COVID. But we're also seeing a lot of headaches, what we call brain fog, where people feel like they're just not thinking as clearly as usual. Those are really the most common things that we're seeing.
Yeah, and I remember shortly after the pandemic, people started reporting these symptoms. And, you know, we're going into year 2 that we've been dealing with this. So what have you learned about how COVID is affecting the brain, hitting these issues, and why?
So unfortunately, we still don't know a lot about it. We know that COVID enters the nervous system very early on. It enters through, we think, the olfactory system, and then causes inflammation. And we think that's the main reason why we get some of these neurologic complications. But it is amazing how little we really know about this.
Okay, with as little as we know right now, what do we know about, on average, how long these symptoms tend to last, and have you found a way to treat it?
So there's really a variety when we think about duration of symptoms. Some people, it just lasts for a few weeks, or some people don't even have symptoms. Others, it lasts months. And we're not sure exactly why that is.
Mm-hmm. How about
in terms of treatment, we can treat some of the symptoms, but because we don't have a clear understanding of why this happens, we don't have a clear treatment for these symptoms overall.
You know, there have been smell and taste researchers for years who have tried to find ways to get people to get these senses back. Are there any particular techniques that people might look into as they're at home sitting and watching and saying, you know what, I've got that and I've still got that, and I don't know what to do about this?
So there's a lot of research going on, as you can imagine, for this. There's some therapies that you can look into to start recovering from this. But again, not a lot is known about it.
Okay, but you guys are still studying this, correct?
Absolutely.
So are you looking for anybody to become part of your study? What's happening with this now?
So there's multinational studies that are ongoing. So if you are having symptoms like this, it's important to talk to your primary care physician or your neurologist, because there are studies that are enrolling to look at the course and kind of understand more about this disease.
Okay, and in the meantime then, do you have any hopeful words for those who are still dealing with this? Are you finding that it will eventually all come back?
For most people, we do see significant improvements, usually early on. And we do see that most people improve completely. So just be patient, see your doctor and see if there's any medications we can give to help those signs and symptoms. And for people who don't have symptoms, the best thing to do is to get vaccinated to prevent COVID to begin with.
Okay, Dr. Lakshmi Warrior with Cook County Health, thank you for joining me this morning. Important topic. I think it's going to be one of discussion for a while to kind of, hopefully you guys are going to figure this all out for us. So thanks for joining me this morning.
We'll do our best. Thanks so much.
Have a great day.